Welcome back, day 21 of the 27-day mobility challenge here at the Reprogram, and we are continuing on with the lower body, looking at these prerequisites, these essential ranges of motions necessary so that our joints can perform in a healthy manner and we reduce the risk of injury and minimize the degree of damage should anything happen to us, should we be pushed into these unwanted compensation patterns. Okay, so today we are talking about hip flexion and external rotation, a huge component of lower back problems, sciatic nerve injury, hip impingement, knee problems, knee injuries, ACL, MCL tears, meniscus tears. And what happens is generally what we see after, in today's modern world with people being sedentary, what happens is they lack that rotational capacity for the hip to turn out when accessing that deep pocket, that pocket that I like to talk about, that full squat position, which is a very rare position to access nowadays because we have chairs and benches to sit on, right, and sofas, right? So throughout the day, we rarely access that full hip flex position. So the external rotators rarely need to be utilized, or external rotation, rarely needs to be utilized to activate and keep the hip centrated through that flexion extension range of motion. So what happens is we lose it. And we can see, because when we can always tell with these desk workers or people who have been sedentary for a long time, or in a half squat sat position, when they're standing, they cannot actually maintain that central hip position because they've lost the ability to extend and rotate their hips. So what happens is we see it in a feet turned out kind of position. They look for stability, or their body tries to find stability in a foot or a pigeon toe or duck toe turned out position, and it's deceiving because you kind of think, oh, there is external rotation there because the foot's turned out, but actually it's not. The femur is stuck in kind of a lack of external rotation, if you like, because they don't have that space in the hip anymore, and the feet are trying to find that stability to maintain that torque or loading on the hip. And what happens then is that we get a myriad of compensation problems after that, where the glutes get tight, the glute medius, the other external rotators of the hip start to get short, and then as well as having tight hip flexors, which is probably where most of it's all started, where they're sat at a desk for hours and hours. There's a lot of inhibition in the muscles in the posterior chain, and what happens is that the lower back and the bottom of that lower back and the SI joint has to take that loading, that centration of posture. As we're standing, there has to be a kind of stable point of integration, and it's no longer the hips, it's now the lower back. So we end up getting a lot of lower back issues, and that's one of the prime mechanisms for sciatica as well. And then moving on, as I said, down to, of course, when we do see these people try and squat as well, we get a very toes out but knees caving in. So that obviously, we can see that if they're ever to be forced into that position during physical activity or some kind of like day out with the kids or something, you know, these guys, this medial knee translation is going to be, most of the time, most likely going to end over time, end in MCL, ACL, or meniscus rupture. Okay, and people just, they never get told why. You know, it's just, oh, it's unfortunate, you need surgery, blah, 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 blah. But if only they had seen a video like this before the injury happened, they could have saved themselves and understood everything, right? So today we're going to go into a modified version of the FABER's test, flexion, abduction, external rotation. So we're going to do that in the form of a pigeon pose. And it also does trigger a bit of hip extension as well with the trailing leg, and we'll show you that now. All right, this is the modified version of the FABER's test, flexion, abduction, external rotation, looking at this balance of external rotation in the hip or lack of external rotation in the hip. And it really, by doing this modified version of it, it really allows you to load the tissues, whereas traditionally you see a physical therapist and they'd have you lie on their back, they'd flex your hip to 90 degrees and then rotate it through to external rotation, trying to look at the range of motion, whether it reproduces any pain, discomfort in the joint. But if we load these tissues ourselves, there's nothing better than feeling that biofeedback from your own body, particularly when we look at the movement unilaterally. So we're also looking for asymmetries. Whenever we test a right leg and a left leg, we're looking for asymmetries. And an asymmetry or an imbalance of rotational torque across the hip and the SI joint wreaks havoc on the lower back. Okay, so this is what the position looks like. What we're going to do is we are going to bring the front leg up, okay, and you are going to hold it with your hand, and then the first phase is to sit in this position This like pigeon pose. It's like yoga, traditional yoga pose, a pigeon pose. And what I want you to make sure is that the toe is level with the knee. There's a line between the toe and the knee, and this makes sure you have adequate flexion in the knee. If we try and bring the foot too far up, it will crank on the knee joint and really upset the lateral ligaments. You'll overload them, it'll be too much strain, and it will really start to inflame and ache, and sometimes that can take ages to get rid of. So really be careful. Make sure that toe, you do not go further than that line, okay? The second stage is to just sit in this position. I'm now loading my tissues. I can feel that stretch in the glute there and the piriformis and the external rotators in the hip. I can feel that lateral line being loaded as well a little bit, and my thigh is completely flat to the floor. I can also feel a bit of a stretch in the hip flexor here through this extension of this hip. So it's kind of like a 2-for-1. The second phase is that you're going to lie down and make sure the chest is on the leg. And that is a pass, okay? And as you can imagine, a fail for this would look like a bunch of different ways. They could get down here, try and get this knee down, and they'll be hitched up like this. They won't actually be able to get the thigh on the floor. You won't be able to get the thigh on the floor. You won't be able to get this hip down, and you'll feel a big stretch here. It really is a position where it biases out a lot of extreme range of motions, end ranges of motion, should I say, not extreme, end ranges, that you just haven't been in possibly for years. And then another one is that they just cannot bring their body up. They're falling over themselves. You stay in this position. And that's kind of where, another one as well is that if you do get in this position, you feel like you're falling sideways. You can't actually stay up because those external rotators are so tight. All right? So that is the modified version of the FABER's test. Okay? If you like what I'm talking about, you're interested, and you want to see what I do and how I can help you, check out www.thereprogramonline.com. We'll see you tomorrow. Check this out.
Hi there, I'm Andrew Graham, founder of The Reprogram Online, and if you're here, it's likely because you are feeling the frustration of a body that just isn't performing the way it used to. Maybe it's the nagging joint pain, the frequent injuries, or the simple truth that despite all your efforts, you're not seeing the results you desire. As a busy professional, I understand how valuable your time is. You want a body that not only performs well, but one that you can enjoy and that you know is capable of handling whatever life throws your way. Yet, finding the right path in today's fitness industry is like navigating an untamed jungle of misinformation, quick fixes, and empty promises, often leaving you frustrated or worse. That's why I created the Reprogram, a comprehensive training system designed to not only build a strong athletic physique, but to do it in a way that prioritizes injury prevention, joint health, and longevity. By merging concepts from physical therapy and strength and conditioning, the Reprogram targets and alleviates the very issues that are keeping you from moving forward. Starting with our free mobility assessment, we will identify these issues, as well as your potential risk of injury, and design your training program based on your results. You see, many people think they need more, but often what they really need is better. It's not about lifting the heaviest weight or doing endless reps. It's about focusing on what truly matters so that you can build a body that's not only aesthetic, but resilient. A body that works with you, not against you. The Reprogram is built for men who understand that their body is their most valuable asset and who refuse to let joint pain and past injury dictate their future. Using the 3-stage training system, you'll regain your mobility, correct muscle imbalances, and improve your posture, all with minimal equipment. I mean, imagine a life where you're not just managing pain, but actually eliminating it and getting stronger every day. Believe me, I understand the frustration of trying to stay active when your body seems to resist every step. But with the right approach, that frustration can quickly turn into fuel for change. The Reprogram is designed to respect your time and deliver results in a way that actually teaches you about your body. So, are you ready to break the cycle and unlock your potential? Then I invite you to start your journey today. Remember, this is about you, investing in your future, your health, your quality of life. Click the Get Started button to begin your free mobility assessment. I'm Andrew Graham, and I'm here to help you banish pain, optimize mobility, and unleash strength one step at a time. Let's get started.